Someone had a question about Mortons Neuromas, and I wanted to give this video to give a little bit of education and may empower you to figure out what the foot doctor, the foot surgeon is going to do with you if you get to that point. Neuroma is an extra growth to any kind of nerve tissue. The specific ones of the foot, if you look at the foot, they'll have nerves that come from the leg. Actually, they come from the sciatic area, go down the leg, they branch off at different areas. But there are nerves that run between the metatarsals or the foot bones and end up in the distal toes. I use these PVCs as a demonstration for the bones of the foot. The bones of the foot, right before they get to the toes, have a little head to them. And if you look at where the nerve goes between each of these bones, like this, and then it has a little fork at the end. It forks right before the toes split. And at the fork, where say the third and the fourth, I didn't put a fifth one here, but the third and the fourth metatarsals are, it'll be a little thicker than the rest of the nerve tissue because it's about to split. So the fork is thick. Not only is the fork thick right here, right at the bifurcation it's called, you also have the heads of the metatarsal bones of the foot, also with an extra large space. So you can see how if the fork is wide or the heads are arthritic, you're going to kind of crush the nerve. When you crush nerve, it hurts, and then it reacts by getting thicker. So you have this big blob of nerve tissue that doesn't fit anymore, that causes pain, especially every time you step. So I'm going to give you an example of what usually happens. Usually what happens is because of the pain, we try to, or the foot doctors try to inject the area, destroy the nerve, sacrificing your sensation to the inside and the outside of the toes, on the corresponding toes, figuring that you probably don't need the sensation and it's probably worth it to destroy the nerve. That's the old-fashioned way. Sometimes the doctors now will cut the nerve out, or maybe even before that, they'll try to inject steroids to the area to calm down the inflammation. Even before that, though, my suggestion would be, if there's no great arthritis to the heads of the metatarsals, then that's one good thing. The problem that we'll come up with is, if there's an irritation and it's temporary, nobody wants to stop walking around on the foot that's irritated. If you stop walking around the foot and get up off of it, usually the irritation at the fork, whether it's the third and fourth, the second and the third, the first, doesn't matter where it is. Usually it's the third and fourth or the second and the third. But usually the irritation will go away if you give it some time. If you continue walking, even if you got it to 5 days off of your feet, the foot that hurts, and the swelling goes down, and then you go and do things again for 8 hours in a bad position, you'll swell it up again. Anti-inflammatories definitely help, but we sometimes we don't give enough time, I believe, of being off the foot, because the irritation has probably come from some kind of overuse. The other thing that usually causes irritation is the shoe wear. This is a woman's shoe with a heel, and usually when you have a heel, the foot goes up like this. It cants up. And well, that's a bad description, but if your foot is canted up, you put more weight on the forefoot, the ball of the foot. And that's where the Mortons Neuroma usually starts to develop. Not only that, women's shoes are very narrow, so you're putting the toes, you're crushing the toes together, and you're irritating the nerve. So not good when you have an irritation. Men's shoes, typically, well, the older style of men's shoes, brogues, are usually pretty wide-based. Men have bigger feet and wider feet, but the shoe wear for men is typically wider. I've seen some narrow shoes coming into style now, and I bet you men are going to start having problems. But the idea again is to wear the proper shoes. If you can get into a post-op shoe, which is essentially a flat bottom, hard cardboard, hard rubber shoe that has Velcro on top that you get at the doctor's office, that will be enough space to give your toes a little bit of rest time. If you get the notes to say that you can't travel, can't walk as much, then over the course of 10 days to 14 days, you should be able to heal that up with the proper change in diet. Nutrition has to be an anti-inflammatory diet. If you go and drink alcohol for 2 weeks while you're trying to heal up, well, guess what? Your nutrition is not going to help this little nerve head, this neuroma, reverse itself. Body is a miracle, and usually the nerves that get irritated can reverse themselves and fix. But if you do nothing to reverse or fix them, or you're only partial with getting off but not maintaining a good diet, you're going to take twice as long. And make it 4 weeks, but who's got time to stay off their feet for 4 weeks? So we want to be on a good nutrition or a good nutrition practice. We want to be avoiding irritants like alcohol. We want to take care of deficiencies, and a lot of people will not be eating the right things or be low on, they say, their vitamin D, not enough fish oil. The other thing is to maybe use things like an natural anti-inflammatory. I love the way turmeric works to decrease swelling. Specifically for nerve, sometimes B6 will play an important role for healing nerve tissue as well. A lot of my carpal tunnel surgeons will usually use that specific B vitamin because our average diet is lacking, and we've seen some case reports where when you cut the carpal nerve or the carpal tunnel to let the median nerve regrow or refresh itself, B6 sometimes speeds up the healing process. Wouldn't hurt to do it in the case of a Mortons Neuroma as well. I like using topical anti-inflammatories. Sometimes they will get to the area of irritation without upsetting the stomach. That would be, and usually they're prescription covered, but you have to check with your insurance company. Sometimes topical oils like helichrysum will help with the healing process as well. I think that acupuncture is unfortunately not as well utilized as it should be, but I've seen acupuncture take away irritation to nerve very quickly. You just have to get to a decent acupuncturist. The other things too that you can sometimes try is, if you look at what happens in the dynamic of the foot, let's just use this, has the foot comes down, pushes off, comes down, pushes off, as this foot does what it's supposed to do. When your foot is up, the metatarsal bones splay apart. When the foot is down, so when it's up, metatarsal bones splay apart. When the foot is down and weight is provided to the ball of the foot, metatarsal bones come together. So there is something called a metatarsal bar. It's a bar. I'm just going to use the wooden stick as a description or an illustration of what happens with a bar. When you put a metatarsal bar under the ball of the feet, it spreads apart the heads of the metatarsals. So if the heads of the metatarsals are constantly, if your foot is constantly kept at an inclined position like this, then usually the metatarsals are kept wide, and the space where you're trying to heal up the neuroma is allowed to breathe a little bit. But you have to, it's hard to find metatarsal bars. Usually you have to have a podiatrist make one, or make an orthotic where the front is higher and elevated compared to the heel. You also have to have a lot of room in the shoe, so there are metatarsal pads that I've used in a pinch for some runners. You stack up 2 or 3, but you will have to have the toe box of your shoe allow for all that extra space. So metatarsal bars are helpful. Anti-inflammatory is definitely helpful. Sometimes prednisone, a steroid, although my patients don't like using steroids, it's better than going to surgery, and it will bring you a truncated a way to take care of inflammation. The side effects of steroids are very minimal, unless you have anxiety or diabetes. Then it's a problem. But again, if you want to reverse the irritation to that nerve and allow the nerve to heal itself up, B6, maybe prednisone, an anti-inflammatory of some type, turmeric if you can take it, something topical, and then the limitations of further damage. For those of you who are on your way to surgery, you just have to maintain a good practice of nutrition and relaxation and no further damage, and the surgery will probably do you well. I have a lot of people that, it's a simple surgery, but we try to avoid cutting as much as possible. So, and then the other thing is weight control. If you're obese or overweight and your mechanics of the stepping and the feet are starting to suffer, then you're going to have other things come up sooner or later. So working on your BMI would be most important. Sometimes the Mortons Neuroma will be the first thing that comes up. Then you'll hear about arthritis, then you hear about knee pain, then you'll start to have sugar problems. So don't wait until all the diseases start to pop up. Just listen to the warning signs and listen to your body. The final thing is, your doctor, you can usually write you a temporary note while you get everything I just mentioned into place. But being very patient, and it's usually 10 to 14 days to see if this conservative treatment will work, is important. If you're suffering too much and somebody has to give you a pain control medicine, then you're probably on your way to getting the Mortons Neuroma cut out. You can either go to an orthopedic surgeon that specializes in foot and ankle problems, or a podiatrist, and both of them are very legitimate. I think that the one benefit with the podiatrist is they sometimes, not sometimes, but they can usually construct. They're very good at constructing orthotics. I have a doctor that took care of a couple of Olympians, and he does great with the way he makes his constructed orthotics. But try to look in your area, see who's available, and if you can't find anybody, then your primary care might be able to give you a little bit of advice. Usually, in my opinion, the primary care guys that help should have some training in sports medicine. So just know what your options are. Know that it's probably a message from your body that there's a couple other things going on in either your shoe wear or your lifestyle, and hopefully it reverses really quickly.